Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is our last Facebook Live of the year. It's December 30, 2021. As always, we are here to take your COVID questions live, and I'm sure you have a lot of them. We've been getting a lot of questions in about the new CDC guidance related to isolation and quarantine. We've been getting questions about the proof of vaccination requirement to go into certain public settings that goes into effect on Monday. We've got questions about masks. So let's go ahead and dive right in. As always, we will start with looking at our Chicago data, and I encourage you to explore the dashboard. You can put your questions directly into the box below on Facebook or Twitter. You can also use the hashtag AskDrArwady. So if you go to chi.gov/COVID-, you will find our COVID dashboard, and you see that broadly the news here is not good from a COVID perspective. You can see we're averaging over 3,700 COVID tests a day, positive COVID tests a day, which is up almost 50% from a week ago. And if we zoom in here, you actually see there have been a couple of days here where we've broken the 5,000 cases per day mark, 5,454 a couple of days before Christmas. And you see that this is the highest that we've ever been in terms of cases. Now, we are testing more than we were a year ago and much, much more than we were way back at the beginning of the pandemic. But nevertheless, you can see this is one of the steepest increases that we've seen, and this is due to the Omicron variant. This is also why I am guessing every one of you knows somebody, at least indirectly, who has COVID right now. Couple other things. Hospitalizations are also very much on the rise. We are averaging 95 Chicagoans being newly admitted to the hospital each day with COVID. That's up from 70 per day a week ago. And again, if you look at the graph here, and if we zoom in on that, you see that this is also rising quite quickly. We're still not up to where we were with the surge last winter, and we're nowhere near where we were in the very first surge. But nevertheless, that is concerning, and we're going to talk a little more about who's getting hospitalized with COVID in just a second. Deaths are up, but nowhere near where they were prior to the vaccine being available. We're currently averaging 11 Chicagoans dying from COVID each day, the vast majority of those unvaccinated. In terms of vaccinations, these are down just a bit. We're averaging just under 10,000 vaccinations a day. Some of this, though, is because of the holidays and because we just have a lot of healthcare workers that are also out with COVID. We've got people on our own at-home vaccination team that have been out. We've got people who in vaccination sites across the city, pharmacies, et cetera, between the holidays and the current surge, we've seen some decrease in workforce there. But nevertheless, about 10,000 every day, so making progress. We're testing a lot, averaging about 28,000. You can see, again, that's down a little bit this week, both because of the combination of the holidays around Christmas, somewhat less capacity in terms of healthcare workers, still much, much more than we were at any point earlier in the pandemic. And in this setting, our positivity is very high, 16.7%. What does that mean? Almost 1 in 5 of the tests that are being done in formal labs are coming back positive. A number of you have been writing in asking about questions related to at-home tests. At-home tests, by and large, do not get reported in these official statistics. There are some. If you do an at-home test, there's actually a QR code, and there are a few of them that actually do connect in. There's an indirect reporting, but the great majority, we know, are not reported to public health. That is not a problem, because what we're really looking for, we have never counted every COVID test. We look at the combination of cases and positivity together to really understand what's happening. And this is not dissimilar from the kind of surveillance we do for flu. So a 16% positivity, tells us that there is a lot of COVID out there that is going undetected, at least in the formal system. I'm sure there are many people who are getting an at-home test. We don't need you to go out and officially follow that up with a positive confirmatory test. At this point, with this much COVID, you should presume it is COVID unless proven otherwise. If you get a positive at-home test, you have COVID. You don't need to go out and try to confirm it. If you have cold symptoms or flu symptoms, chances are very, very good that you actually have COVID, even if you think it's the cold or the flu, regardless of test results. So you can see that positivity is almost twice what it was a week ago, which is almost twice what it was a week before that. All of this is due to Omicron. We've also gotten a bunch of questions in wondering what's been happening with children recently. And I know with the plan for many of our schools to come back next week, there's concern about that. So let me remind you how to do that on the dashboard, first of all. So we go to cases, and let's look at, for example, you can limit what you're interested to. Let's look at like the last, I don't know, month or so. Let's see, there's the last month. So in the last month, this is what's been happening with cases, hospitalizations, and deaths. And if you break it down over here by age, first, if we look at cases, so this, see how this defaults here to cases by age? So currently, we are averaging about 570 0 to 17-year-olds being diagnosed with COVID each day. And 5 children across the whole city being hospitalized with COVID each day. You compare that to the oldest Chicagoans, where there's only 53 Chicagoans over 80 being diagnosed with COVID, but among those 53, 10 are being hospitalized and almost 3 are dying. Whereas in the kids, 570 goes to 5 hospitalizations, goes to 0 deaths. But what's interesting is if you actually look at the case rates here, we by far have the highest case rates in our young adults. People in the red and the blue here. Let's blow it up so you can see. So the light blue are people 30 to 39, the red are 18 to 29, and that is where we are seeing the most cases being diagnosed, followed by people in their 40s. Kids 0 to 17 are in blue here. If we look at hospitalizations, this is where we're especially interested. You can see that, thank goodness, hospitalizations have not significantly increased here where we look in the 0 to 17-year-olds. They're up, a tiny bit in the setting of Omicron. We've gone from, maybe 2 COVID hospitalizations in kids each day to 5 right now. But still, the hospitalization rates by age remain the highest in those who are older, and especially if they are unvaccinated. So let's take a look at, first of all, answer some of your questions about what's happening with the new CDC isolation guidance for the general population. So for the general population, Chicago has adopted this new guidance, and I'm happy to take questions about that. But here's what the guidance itself is. Regardless of your vaccination status, if you test positive for COVID-19, you need to isolate. What does that mean? You need to stay home and isolate for 5 days, meaning even from other people in the household as much as possible. After 5 days, if your symptoms have resolved, you can leave your house, but you must continue to wear a mask around others for an additional 5 days. You should avoid contact with high-risk people. And if you're still feeling sick or you have a fever after 5 days, you just continue to isolate at home until you feel fine. So this is the shortened isolation guidance. And the quarantine guidance was also shortened. And we can answer additional questions that you have about this. But let's talk for a minute about what is happening with hospitalization. So I showed you a minute ago that we're averaging about 100, just under 100 Chicagoans newly being hospitalized each day with COVID. And our current average of how many people are in the hospital with COVID is in the sort of 750 to 800 range, the highest census that it's been since December 2020. You can find this information, by the way, if you go to the hospital capacity on the dashboard. Let me move into the slideshow view so it's a little bigger. Okay. And ICU, similarly, on the increase, we're currently averaging 208 Chicagoans in the ICU with COVID, and that's the highest it's been since January 2021. a lot of you are asking what's happening with breakthroughs, what's happening with breakthroughs and boosters and hospitalizations. So I pulled 2 graphs off our website. You can go to the breakthrough tab if you want to see more details there. But the good news is that vaccine is still providing protection against infection, though not as much as it was. We are definitely seeing many more breakthroughs with the Omicron variant. So let's talk about this graph. This is just infections, okay? People who test positive, regardless of how sick they get. And this is the weekly rate per 100,000 population. So what you see, this black line is roughly Thanksgiving, that the highest rate right now of infections is in unvaccinated Chicagoans, getting up close to 1,000 per 100,000, 1% of unvaccinated Chicagoans testing positive each week right now with COVID. In comparison, vaccinated but not boosted, not yet boosted, due for a booster but not yet boosted Chicagoans have a lot of protection there if you compare this. Now, but it is up, right? We were seeing fewer than 200 per 100,000 per week vaccinated Chicagoans, and that has doubled to more than 400 with Omicron. That's exactly what you're seeing. Now, people who have gotten a booster, even more protected on top of that, but their risk, has gone up. It's in the range of 300 or so per 1,000. So overall, if you're unvaccinated, your risk of being infected remains 3 times higher, give or take, a little more. And all the way since Thanksgiving, case rates among unvaccinated are about 2.7 or 3 times higher than those who are fully vaccinated, and about 4 to 5 times higher than if you're boosted. So, for example, I've had some people writing in. Pam Petrowski on Facebook said, how common are breakthrough cases for people who have had all 3 shots? I know people who have had all 3 get breakthrough infections. This is your answer to that. This is what we're seeing for the weeks that are ending with the dates shown. And so basically 350 out of every 100,000 people who have been boosted are having a formal positive test. There would be some more than that probably who we don't have a report for, but the main difference is the main risk remains unvaccinated. I also would just point to this graph where some people like Alejandro Gaona on Facebook is writing in. I mean, she has a few comments, but she says there's 0 data confirming vaccines protect others. Why is there insistence on vaccinating everyone? So remember that you have to be diagnosed with COVID to spread COVID. You cannot spread COVID unless you get COVID. So this is step 1 here, that the fact that people who are vaccinated and boosted have a much lower rate of infection. In addition, people who are vaccinated and boosted, if they are infected, their time of infectiousness is much shorter. So even if they are infected, they're much less likely to spread than those who are unvaccinated. Then more importantly, we've got people, a number of different folks, I don't have the names here, but a lot of people writing in about what's happening with hospitalizations. And this, to me, is the most, if you are looking at nothing else, please look at this slide, because this is the answer for Alejandra and others, and people who are saying, why are we pushing vaccination so much? Because, do you remember I showed you a couple of slides ago, we're seeing this happen with hospitalizations. Remember, my biggest concern of all time, always, is protecting the healthcare system, because we see the healthcare system get overwhelmed. We can't care for people who have other medical needs. That has ripple effects that are absolutely not sustainable. And so we are always paying a lot of attention to hospital capacity. So who's getting sick? Well, here's the answer to this. If we go back sort of through this recent surge, and if you really look through Thanksgiving there, where are we seeing an increase in hospitalization? In that red line, in unvaccinated Chicagoans. In vaccinated Chicagoans and boosted Chicagoans, we are seeing a few get admitted to the hospital, for sure. I don't want to say that they're not, but where we are seeing vaccinated and especially boosted Chicagoans get admitted, they tend to be older with underlying conditions, where we're talking about middle-aged, younger people, generally healthy people. By and large, everybody in the hospital right now who fits that category is completely unvaccinated. And this growth that we are seeing in Omicron is in unvaccinated Chicagoans, nearly all of the increase. And so the difference between these two charts is that, yes, we're seeing a big increase in breakthrough infections, but most of these are mild. We are also seeing a big increase in hospitalizations, which are not mild, and these are Omicron. People who are writing in and saying, I'm reading that Omicron is not dangerous. Please look at this graph and know that most of the people right now in Chicago in the hospital with COVID have the Omicron variant and remain unvaccinated. And the fact that, to me, the reason I am not completely freaking out, honestly, about these COVID numbers and what they're doing to our hospital capacity at this point is because of this graph, because I am very reassured that the vaccine continues to protect really well against severe illness. I remain very worried about this steep increase that we're seeing, especially in the unvaccinated. And of course, I'm worried for the people who are vaccinated and boosted, who are still getting sick and getting admitted. But the most important thing for us to prevent deaths, prevent hospitalization, and protect our healthcare system is to have fewer people in that red category, unvaccinated Chicagoans. And so for all of you who are still remain, who continue to question whether vaccines work. Someone wrote in, the vaccines are research, they only protect the individual, et cetera, that are they research? They are prevention. I don't know what exactly you mean by they are research. There was a lot of research that has been done around them, of course. There have been more than $8.5 billion given around the world. The research has shown that these vaccines are safe and very effective, especially against severe outcomes, and that's as true right now in Omicron as it has been all along. So, what is the guidance? Hasn't changed, but it's become more important in this surge that we double down as much as we can on the things that we know help. So vaxxing up and boosting up remains the most important thing. Masking up is increasingly important, and I see we're getting some mask questions, so I'll get into those as soon as I get off the slides. Back up, which literally means try to keep your distance where you can. Washing up continues to help. Flu is also on the increase, so all these things help. And then testing is increasingly important because Omicron is moving faster. And so, we shared this yesterday at the press conference, but guidance for gathering in Chicago, it's New Year's Eve tomorrow, and I do not recommend gathering inside with anybody who is not vaccinated and boosted at this point with the amount of COVID that we have here. I'm not gathering with anybody who is not vaccinated and boosted. And in fact, we are also testing if I even do decide to gather, regardless of vaccination status. Wearing a well-fitting mask is increasingly important, and we'll talk about that. Please, 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 if you are not fully vaccinated and ideally boosted, avoid gatherings, avoid travel right now. Not just Chicago, but the state of Illinois and the United States have been breaking the record day after day for the most COVID cases right now. That is Omicron, and the risk is high during travel. And then finally, if you are sick, stay home. If you think it's a cold, if you think it is the flu, it is probably COVID right now until proven otherwise by a test. And it's taking a long time for especially the PCR test results to come back because the lab capacity is stretched across the whole country. And so what I don't want you doing is thinking, oh, it's just a cold or the flu, and I'm gonna take a test, and unless it comes back positive, I'm going to go about my business. Stay home until you've got a test result and are confident that it is not COVID. And if you're unable to get a test, just presume it is and stay home for at least 5 days and wear your mask for 5 days after that. Finally, we did get some questions about with the mandate, the vaccine requirement coming in for restaurants, gyms, and entertainment settings that are serving food and drink. You can bring your vaccination card. I strongly encourage you, if you have not, if you are someone who uses a phone, take a picture of that card, just a basic picture of it, and then click the little heart. That adds the photo to your favorites. It's true on Android, it's true on Apple, and that lets you access it more quickly. You are welcome to use any of the apps. The state is working on some additional apps and ability to check on things, but keeping it simple is also important. And please do this if you have not already, because there's going to be more places where you're going to need to show your card. And as always, we continue to answer the phone 7 days a week, 312-746-4835. We are signing people up. We are still doing COVID vaccines and boosters through at home around the city, and answering the many questions that all of you have. So let's get into some more of those questions. Okay, so we've got Adam Garcia on Facebook, Connor on Twitter, Lisa Wyness on Facebook, all asking about this new isolation guidance. Why 5 days? Instead of 2 weeks? What if after 5 days I still test positive? Is it 5 days after symptoms resolve, or 5 days from onset, as long as symptoms have resolved? Okay, so let's talk a little more about the isolation guidance. So first of all, Connor, to your question, it is 5 days from symptom onset, as long as your symptoms have resolved. So it's not you wait for your symptoms to get better and then you do 5 days. It's from when your symptoms start. This needs to be 5 days. And just to put this in some context, the isolation period, the recommended isolation period had been 10 days, right? For a long time, we've been recommending if you get COVID for 10 days from the day that your test is positive or your symptoms start, you need to isolate. Really, after 10 days, even if you've not fully recovered, you're not spreading COVID anymore. What has been seen with the Delta, and then now especially with the Omicron variant, is that everything is just moving faster. So the incubation period time is shorter from when people are exposed to when they are infected. Their time to developing symptoms is shorter. Their time during which they are potentially infectious and the time when they recover is also shorter. And this is probably a combination, both, a shorter period can help a virus spread more easily, up front, because remember, you're the most infectious right around the time that you develop symptoms, and you can spread COVID even before you have symptoms or a positive test. That's been one of the most challenging things about COVID. It's why the masks are even required, because you cannot know it and have COVID. That's part of the challenge, and that's why, especially during a surge, the indoor masks are important. But what as soon as the CDC guidance came out, let me tell you, the first thing I did was call up people at the CDC and say, I want to see this data. Talk to me about what you're looking at. Where is this coming from? And there's been some really nice, what's called viral decay data, that you look to see what is happening with viral loads, and some real life studies and sampling to see how long after being infected, knowing that things are getting sped up as the virus has continued to change, are people still spreading COVID? And particularly after 7 days, that risk dropped to virtually nothing at this point. So what had been 10 days, sort of this back up to 7 days, was pretty much a no-brainer, it sounds like, in terms of looking at this data and the modeling. And although this made much less news, CDC had already dropped the length of the isolation and quarantine guidance in healthcare settings to those 7 days, because there have been a lot of healthcare workers out with COVID. Now, one of the most important reasons for this is because a lot of people are now vaccinated and boosted. And so in people who are vaccinated or boosted, it's very common for them to have a very mild infection and sometimes have almost no symptoms, and certainly 5 days later actually be feeling fine. And so the question was, is there still a risk of transmission? And when the scientists were looking at this analysis, really the risk at 7 days is virtually gone, and the risk between 5 and 7 days is much lower. And so outside of more sensitive settings, basically having a 5-day period, as long as people's symptoms have resolved, and then it's as long as symptoms have resolved. If people are still feeling sick, just stay in. Please keep isolating up to those 10 days just to be sure. But if you're feeling fine, and if you're vaccinated or boosted, we are seeing people who are feeling just fine, then the chances of you spreading it are down to almost nothing at the 5 days. And the combination of that plus the masks and, you know, keeping away from people who are high risk for another 5 days after that, I do think makes sense. So that's why. And then Lisa, to your question, what if after 5 days I still test positive? So good question. This depends a little bit on what kind of testing we're talking about. And the PCR tests in particular are very sensitive. What that means is they pick up even a small amount of COVID, and they can pick up sort of dead COVID that is not you're not infectious with it, you're not spreading it. And that's something that we've seen can go on for days or sometimes even for weeks. But this has been actually very, very well studied. When the scientists look, they take the actual same sample that the PCR was positive, because the PCR is just looking to see, can you find the genetic fingerprint for the virus? It's not looking to see, is that virus replicating? Is it spreading? Is it growing? Is it contagious? And they're not actually able to grow that virus. It's not alive. You're not contagious with it. And so we actually recommend against trying to have people do a test to return to work, return to school, et cetera, because that test can stay positive at a time when you are absolutely not spreading COVID. And so if after 5 days, the question is not what do you do if you still test positive, the question is what do you do if you're still having symptoms? If you are still having symptoms after 5 days, you should continue to isolate. If you've got at-home tests and you're taking them, and you're still testing positive, certainly if you're able to, you can continue to isolate. But please don't try to use PCR tests around that, and there is no requirement for using the at-home tests. Please rest assured that certainly after 7 days, risk of spread, no matter how sick you are, looks to be virtually nothing with the Omicron variant. And in that 5 to 7 day window, it's much, much lower. And that in combination with sort of masks and not being around other folks is where it is. Okay, we've also got a number of questions here about getting vaccinated after being COVID positive. So Erica Wagner on Facebook says, how long after a positive test can you receive a booster shot? Marcia Burgess from Facebook says, how long after being COVID positive do parents have to wait to get kids 5 to 11-year-old vaxxed? And then Jack Burns on Facebook says, why boost if you are vaxxed and then had COVID? Okay, so slightly different versions, but similar questions here. So Erica, to your question first, how long after a positive test can you receive a booster shot? As soon as you're not infectious anymore. You do not need to wait. Early on in COVID, when vaccines were not widely available, we were recommending that people wait, you could wait 90 days after getting infected with COVID because the chances of being reinfected are low in those first 90 days. You definitely have, protection in those first 90 days. However, right now, one of the things we have seen most clearly with the Omicron variant in these studies from South Africa, the UK, et cetera, is that people who are trying to rely on a previous positive vaccine, a previous positive test, previous COVID infection without being vaccinated have no protection against Omicron infection. So the worry is that I don't want people waiting if they've had a positive test to get either a vaccination or a booster shot because, particularly if that was a Delta variant that you got infected with and, you could still be up for Omicron. So I've been encouraging folks in my own life really not to delay at this point getting either vaccines or booster shots. So if it has been now at least 5 days when you're no longer considered infectious after having a positive test, as long as your symptoms have totally resolved. If you want to be safe about that and sort of go the full 10 days out, that's fine, but there's no need to wait beyond that. And I would encourage you to go ahead and be getting the shots. And Marcia, on your question for kids, same thing. Please do not wait. Someone else sent something in saying they'd heard you need to wait 6 months. No, you do not. And I would strongly encourage vaccination. In the kids, the few that we are seeing being hospitalized, same thing there. It tends to be the kids who are not vaccinated. And so for your kids, you need to wait, at least 5 days if their symptoms have resolved. If you want to wait 10, that's fine. But you do not need to wait weeks or months. And getting this done now is good. And Jack, I hope I answered your question. Why boost if you are vaxxed and then had COVID? So if you are vaxxed and then had COVID, you are correct that you do have sort of the best protection in terms of the combination of those two. People who have both recovered from a natural infection and been vaccinated do have the best protection. That said, not knowing the details of which vaccine you got, the timing, et cetera, we are seeing additional protection with the booster. I worry a little less about you if you had the vaccine and you had COVID, but especially if you're someone who didn't have a lot of side effects from getting the vaccine shot, I would still definitely recommend the booster. For example, in the UK, what they saw was for people who had Pfizer, for example, about 6 months post the Pfizer vaccine, you saw protection against infection, not severe illness. Severe illness, the protection remains good. But against infection, dropped from about 80% down to like 30%. That's why you're seeing so many more breakthroughs. However, with the booster, it went back up to about 75%. So that booster does seem to be particularly important. It builds the antibodies back up, and that's a big part of it. So I'd say, personally, I am recommending, with the way COVID looks right now, and knowing that there's a new variant, a lot of people with less protection, especially if you got J&J and you haven't been boosted, I would strongly recommend it. That's especially important. Okay, so let's talk a little bit. Lynn Taylor on Facebook says, what's a good mask? Stephen Hicks from Facebook says, why has CDPH refused to recommend protective masks for the public? Faye State says, what precautions should people take against Omicron transmission? Do people need to sanitize groceries? What constitutes an exposure? Thanks. Okay, so let's kind of do some of these mask ones first. So, Stephen, I don't know where you got the sense that the CDPH has refused to recommend protective masks. We've actually been recommending protective masks throughout, but there is a difference for N95. So maybe let's talk masks for a second. And Lynn, to your question, what's a good mask? The most important answer to what is a good mask is a mask that fits you well and that you will wear consistently and that everybody else is wearing. The reason we have universal masking in indoors, especially while we're in this surge, is that if everybody is wearing a mask, that is actually the most important thing. The most important thing the mask does is give you that source control, helps keep your germs to yourself. You're coughing, you're sneezing, you're breathing, you're talking. That mask keeps your germs in. That still remains the most important thing. While we are, especially in this Omicron surge, and we are seeing high risk from COVID, and we are knowing that you don't need as many viral particles to potentially become infected, having a well-fitting mask is even more important. So what does that mean? It can mean different things for different people, depending on the shape of your face. It's not a good time to be trying to, drape adult-sized masks on kids. I really like the paper, the surgical masks. You know that there's multiple layers in them. This one that I use has a wire both at the top and the bottom, which I like. It fits my face well. And right now, I would also recommend, if people are concerned wanting an additional level of protection, you put a surgical mask on, make sure it's tight and nice around your nose, and you put a cloth mask right over top. That actually significantly increases your protection with things you likely already have available. Now, to Stephen's question about some of these more specific masks, the KF94s, the KN95s, the N95s, there is some difference between those, and let's talk about that. So N95s are a particular type of mask that you actually need to be what's called fit tested for. And this is a mask that we use in healthcare settings. And there's a whole, for those of you who work in healthcare, you know about this, it happens every year. They're a special kind of mask that are for healthcare settings. So public is not buying or needing N95s. And I don't want you actually trying to say, I want, this N95 for this healthcare setting, because if you haven't had the fit testing appropriately, they're stiffer, the seal is often not as good, and for the general public, N95s is actually not what you should be wearing. But for the general public, if you do want to wear the KF-N94s, the KN95s, as long as they are authorized by the FDA, and you can look, the list is available on there. Those are widely available, and yeah, they have some more protection for yourself if they fit you well and you wear them. So, I actually, I do have one or two of the like KN95s. That maybe if I'm getting on an airplane or something, or I'm going to be traveling, there's a point where there's particularly high risk, maybe I'll put that on. But for me, it's actually not as comfortable as these two. These two I keep on. I don't find myself fidgeting with them and taking them on and off. And I keep my nose and my mouth covered. And really, the most important thing is you've got one on that you can wear, and everybody else around you does too. I really do believe that. I've spent a lot of time looking at all the different studies, and there is the biggest jump in protection by far is no mask to any mask. And then after that, you do get some additional protection if you go from a very thin cloth mask to one that's got multiple layers. If you go, from a cloth mask to a surgical mask, if that is like tightly tied and fitting on your face well. If you go to a KN94, N95, there's a little more protection again there. But remember, the most important thing, source control, and that means everybody wearing it. So I hope that helps answer some of your mask questions. Okay, so we've got some questions. Chris, so a couple questions about the vaccine requirement here. So please go to chi.gov/COVID to learn more about the vaccine requirement in Chicago. The actual health order is there. There's a lot of frequently asked questions that we're adding to, but I'm just gonna take a couple of these real quick. Chris Hoffman on Facebook says, does the Chicago vaccination mandate that goes into effect in January apply to O'Hare Airport? It says select indoor places. No. The airports are specifically carved out, and you'll see that if you look at the health order. And remember that, and I'll just take Cassandra Lorraine on Facebook real quick too here. She says, does the vaccine requirement only affect places that cook in Chicago are serving food for dine-in? So to answer both of those, actually, Alondra on Facebook said the order of being fully vaccinated to go to a restaurant bar. Is the order only for the Chicago location, or is the order statewide? So let's kind of hit those. So first of all, the order is not statewide. It is in effect. It will be in effect in the city of Chicago, and we've seen suburban Cook County put it into effect, as well as Oak Park, some of the other suburbs. But no, it is not statewide. But here in Chicago, it does go into effect as of January 3rd. And to Cassandra's question about does it only affect dine-in? Yeah, and if you look at the FAQ, what is specific about this is it is very specific to places that are known to be higher risk for COVID spread, just because of the type of activity that's taking place. So if a restaurant is entirely takeout, the vaccination requirement does not apply. Any restaurant, you can, and it spells this out in the FAQs. If you keep your mask on, you can absolutely go in and pick up your takeaway and take it to go. You can continue to dine for some of these places that have the outdoor igloos, regardless of vaccination status, no problem. You can do deliveries, you can use the bathroom, etc. But if you are going to go into a restaurant, sit down, take off your mask, and have a meal, the vaccine is required. So I hope that helps clarify that. Yeah. And Roger Carl on Facebook, who says, why is this requirement or this mandate if you can still transmit COVID? Explain the science. This conversation is for gullible 2-year-olds. So I don't know. I know a lot of 2-year-olds, and I know a lot of people who actually have had a lot of questions about how to understand this transmission of COVID. So the mandate about transmitting, so how do we decrease the risk for transmitting COVID? The most important thing is decreasing the risk of getting COVID. You cannot get COVID, you cannot spread COVID unless you get COVID. The best way to protect yourself from getting COVID is getting vaccinated. In addition, The masking requirement that remains in place also helps decrease that risk of transmission. And this is not a universal vaccination requirement. Some of you had questions about that. The reason that we're focused on those settings is those are the settings where either in the gym we've seen outbreaks, we know people, are breathing a lot, they're exercising. In some settings we've seen mask compliance not be as tight as it should be, and we've seen outbreaks, including here in Chicago in this setting. And then other than that, it's the setting, even some of the entertainment venues, if they want to decide not to serve food and drink and everybody's got to keep their mask on, then, it wouldn't have to apply. But any setting where that risk is high right now, you just have to be vaccinated. And a lot of that has to do with the fact that that's who's driving our hospitalizations. That's who's threatening the healthcare system, and that's who is at by far the highest risk of both getting and spreading COVID. Just a quick clarification. Sorry for folks who wanted the order to be able to read the order around that. It's chicago.gov/COVID, not chi.gov/COVID. So thanks for that. Thanks for that correction. Okay, so we've got. Dolores Ortiz on Facebook says, what happens when you test positive on a rapid test and negative on a PCR test? Actually, there's a couple other questions. Nicole Wilsey Starr on Facebook says, if I tested positive at home, how can I report this to the health department? And then Tom Rice on Facebook says, you are wrong on testing. Your tests are inaccurate. People with all vaccines and boosters are getting sick. Stop the misinformation. So whole range of questions and comments and thoughts there. Let's take them one at a time. So Dolores, I'm going to put a link in the chat. There's a really, really nice article that was in, it's called The Conversation, but it actually talks about why people are testing positive on what's called a lateral flow test, which is the antigen test, and then negative on PCR. A lot of it has to do actually with just the very, very large number of people that right now have COVID. You can have small numbers of sort of false positives or even false negatives, but please rest assured that those antigen tests are really they're very, very specific. They do not give a lot of false positives, especially. The estimate is that, if you're, for every 10,000 tests that are taken by people who are actually COVID negative, you'll get fewer than 3 false positives. So if you get a positive antigen test, trust it as positive. There is, that can add up when we're talking about how many tests that are in place here. But if you get a positive antigen test, even if you're taking if it's a couple days later and you're taking a PCR, perhaps by then your viral load has actually dropped so much. But also with the PCRs, there's a 5% false negative rate on top of that. So, neither of these tests are entirely perfect, but they're both very, very good. It mainly depends on when you take the test in your infection, what it's going to show. Bottom line, right now, a positive test is a positive test. It is COVID. Please do not get a positive test, especially on a rapid, and then go and try to take other tests. Like I said, the surge in the cases right now is such that it is taking a long time for the laboratory networks to return PCRs. And the last thing I want you doing is thinking this isn't COVID, taking a test, going about your life, and then 4 or 5 days later the PCR comes back and it's positive. You should isolate from when your symptoms begin for 5 days if you're waiting for a test result to come back. Nicole, to your question about, and we'll put that link that just sort of explains some of those numbers a little better. It just takes a while to get through it. If I tested positive at home, how can I report it to the health department? So you do not need to report it to the health department. Please take a look at the QR code. There's always one, depending on which kind of at-home test you're using. There are some that actually have a reporting mechanism, but even the ones that don't, please rest assured that we are looking at positivity. We're looking at the sort of how many rapids versus non-rapids, et cetera. And we don't need every single rapid test result to know what is happening from a COVID perspective, to know that we are in a major surge and that risk is very high. right now, especially for people who are unvaccinated. So you don't need to email me directly with a test result. All test results that are done through any formal testing mechanism continue to be reported, and we collect those across the country. And so Tom, about the tests are inaccurate, people with vaccines and boosters are getting sick, stop the misinformation. Please go take a look right now, a little more closely, if you like, at some of the high-level data that I put up. There are breakthrough infections, including in people with boosters, but they are happening much less frequently than in people who are unvaccinated. And more important than that, the people who are getting hospitalized with COVID, the huge majority of them are unvaccinated. That's who I'm most worried about. So it's not misinformation. I wish we weren't in a surge, but we are. Okay. We're coming up close on time here. Couple of questions about CPS. CPS is actually doing I believe a press conference. I think I'm even part of it later this afternoon at 1 o'clock. So I know there will be some additional focus there on that. But a couple of people, Activist Mama on Twitter is asking about mitigation strategies with Chai Public Schools. Carrie Byers is saying, how are we thinking about a safe and stable return to school? Courtney Ritzma is asking about the percent of kids unvaccinated, how our school lunch period's not going to be super spreaders. So much more to come about schools in that press conference, which I believe is at 1 o'clock. But long story short is that vaccination is really important. So please, if people have not yet signed their kids up for vaccination, that is the most important thing. Kids who are fully vaccinated are not required to quarantine. That has not changed. For adults, we want you to be getting boosters, et cetera, to fall into that range. But the kids, except for just a very few 16 and 17-year-olds, would not even be due for a booster at this point. The most important thing is they've had that primary vaccine. And remember, even before we had a vaccine available, schools are not the major source of COVID spread. I know it's hard for people to understand that and realize that. We've shared a lot of the data around that previously. We'll probably talk about some more this afternoon. And if people have questions, I can bring some more of that back. But we've had a lot of, there have been studies done right here in Chicago, around the country, even around the world, that have actually shown that kids, when they are in school, with the masking, with the ventilation work that's been done, places where folks are taking COVID seriously, we actually see lower rates of COVID than we do when they're out of school and they're often in settings where they may be gathering or seeing friends with fewer mitigations in place. And I will note all along what COVID case rates look like in kids is reflective of what is in the community. It's not affected by being in school. And we knew we were going to see that, but that's true. We've been out of school, right, these last couple of weeks, and we've seen the case rate in kids go up. That is just what happens because of it tracking what we're seeing in the community. The highest risk where kids get COVID is inside people's homes. And we continue to track outbreaks for sure. We shared on here throughout the whole first, part of this school year. I think we had, 50 or something times across all of CPS where you couldn't rule out in-school transmission. Most of those were 2 cases, an example of spread from one person to one other person. Schools are not, honest to God, this is what the data shows over and over again. They are not, where you've got the mitigation in place, major sources of super spread. In fact, kids have lower risk. And if kids are vaccinated, especially, that risk is lower. So more to come there, but I remain, and all over the country, even places that are in worse surges than we are. New York is in a worse place than we are right now. DC, et cetera. Everybody is moving ahead with in-person school because we have seen over and over again that the schools themselves are not the risk for spread, but that the indirect effects of kids trying to do remote learning are substantial. So of course, we've been talking with CPS a lot about really doubling down on the mitigation things that are important, you know, continuing the masking, continuing quarantine where that is necessary. And I do think while we have a lot of COVID in the city of Chicago, you know, we will have probably a more school interruption for sure, you know, over these next few weeks. And there will be whole classrooms that need to quarantine, or at least the kids that aren't vaccinated will. And we may have whole schools that operationally have a lot of people out for COVID. But in terms of a decision to need to not go back as a district, that is not, you know, the health department is not recommending that schools not come back. And that's different than universities. Some of you were asking. Universities often are more able to go remote, partly because, you know, they have dorms, they have much more interaction in settings where people are not masked, are not distanced, and the classes themselves are much more limited and typically more able to be done remotely. A lot of that social, emotional, a lot of the food support, et cetera, that is really important for the younger kids is not as much a priority at that university level. So I know people will have strong opinions either way, but on this one, the data is really clear and has been. And so that's what and we will continue, obviously, to support and help advise CPS as it makes decisions and continues to work to, you know, keep schools safe. Okay. I think we are basically just about at time. Terry Dodd on Facebook, maybe we'll just finish off here, says, I'm ringing in 2022 at home with family and watching it on TV. It's sad that almost 3 years later, there are people who are still not taking this seriously, not masking up. This virus is nothing to play with. As I stated before, I had it twice, and every now and then I temporarily lose my sense of smell. Sorry about that. I hope and pray that this pandemic and this virus will be in our rearview mirror this time next year. Mask up, vax up, boost up, people. We've made a lot of progress, but still got a ways to go. Thanks for everything you and the rest of the health officials do. Thank you, Terry, for that. I appreciate that comment. I share your concern, and I do worry, and I get a lot of, you know, I see a lot of you writing in with, you know, still not thinking that COVID is real, still not thinking that people right here in Chicago are hospitalized and dying from this virus, but they are, especially if they're not vaccinated. And we are in a big surge right now. So I do want to wish you a Happy New Year. I wish that I were wishing you a Happy New Year with less concern about where we are from a COVID perspective. But boy, am I glad, you know, even compared to last year, that vaccine is doing the job it needs to do, working very well at helping keep people safe from severe COVID. It's not 100%, nothing's 100%. But if we can get more people protected, as we move into the new year, a lot of our riskiest spaces in Chicago are going to be safer because people in them will be vaccinated. Our goal is to not shut this city down. Our goal is to stay open, but stay safe. We threaten our healthcare system. We've got to do the things that we have to do to keep that safe and to make sure we continue to have capacity for all of your healthcare needs. Getting vaccinated is the most important thing for protecting your health, your family's health, Chicago's health, and the healthcare system. So I wish all of you a happy and a healthy new year. For those of you who have COVID, some of you feel like I've done everything right and I still have it, please try not to feel shame about that. You didn't do anything wrong. Stay home at least 5 days. I hope you have a mild case. And for those of you who still have not had a vaccination, please sign up. You don't want to mess around. As Terry Dodd said, this virus is nothing to play with. Happy New Year. We'll see you next year. Bye-bye.